All right, Phil, talk to me first about Dr. Fauci. I don't understand his agenda. I don't understand this guy at all anymore. I mean, it should be a cause for optimism, of course, that we're seeing more number of positive cases based on increased testing and a lower case fatality rate.
Yeah, look, I mean, I think the point that he's trying to make is, you could still have a really bad disease episode without dying. You could spend weeks in the hospital, you could suffer. He's saying that's not something you want, but that's not a reason to say it's a false narrative to celebrate that deaths are down, because, of course, the worst outcome you can have with the disease is actually dying. And so, yeah, nobody wants to be hospitalized. Nobody wants to be sick for weeks. So there still could be many outcomes that are still bad that you still want to avoid. But all of those outcomes are a lot better than dying.
Yeah.
So the idea that we shouldn't celebrate deaths going down, I find extremely bizarre. And it's not really just the death rate that's going down. The hospitalization rate has also gone down pretty dramatically as a percentage of cases as we've captured so many more cases. So a significant portion of the case rise are very mild cases that we probably had in the northern states when they went through their epidemics, and we just never knew about because we weren't testing those people.
Right. And I mean, to anybody who is a reasonable, rational person, everything of what you just said, in contradiction of what Dr. Fauci said, is cause for optimism. And it, of course, is cause for everyone to be glad that fewer people are dying. My goodness, that's just human nature to be happy that people aren't dying even when they're sick. Okay, go to the next thing, the email. This was obtained by former New York Times journalist Alex Berenson from a physician in a large Texas hospital. He had to give this under the guise of anonymity simply because he didn't want any administrative backlash. But he said they are seeing higher ICU rates, although they have plenty of room for the patients. But he said that it's because of the lockdowns themselves, because people are waiting so long to get treatment, that their illnesses have gotten beyond just regular hospitalization and need critical care.
Yeah, it's really sad to see this happening again because we had a major problem in New York, New Jersey, sort of those first massive epidemic states where people were seeing on the news how the hospitals were overcrowded, and then they just weren't going. They would have a heart attack or stroke and
Yeah.
not go to the hospital, either because they were scared they'd catch COVID there, or they just thought the hospitals were too busy for them, or whatever the tragic reason was. We had a huge increase in untreated cases of those events and a spike in home deaths. And we're starting to see that in Texas now. There was actually an NBC story about how they had this huge spike in heart attack deaths at home in Houston, and it was up to a couple of hundred of them or something like that in the last month. And they tried to blame that on COVID, even though COVID was a tiny, tiny percentage of the home deaths. They were almost all heart attacks. And they should be self-reflective. They should think about the impact of stoking panic that has on people failing to get necessary care, and that can lead to more severe health issues later, including hospitalization in the ICU. It can also lead to deaths that maybe would have been avoidable if people got appropriate care. So the panic and the fear and the media sort of ginning up that whole machine again, that's very dangerous because it leads to people not getting health care they need for a lot of other conditions.